FoodRx is a food prescription program. So the provider acknowledges that they're food insecure, recognizes that their A1C or BMI is elevated. So we work with them to educate them about what that means and then provide them the food prescription card. They can receive 30 pounds of fresh fruits and vegetables twice a month. We started in the pandemic. Many of our neighborhoods don't have not only food access points, but nutritional food. And so this is Legacy being a good neighbor to support overall health. We could not do this without the many donations that the Houston Food Bank gets. So we really could not do this without the food bank's partnership.
Food for Change really works to address root causes, and really it's a way to get people out of this cycle of needing emergency food assistance. And so it's looking at what's keeping them in the situation that they're in over time, and how can we leverage our food resource to really help them push out of that cycle. Even before the pandemic, right, the CDC shows that as food distribution goes up, food insecurity also goes up. You think we're distributing more food, it should reduce that. But because there's so many other things happening, it's just a huge need, and we have to be able to leverage our partnerships to address multiple things at the same time, because the landscape looks completely different than it did 2 years ago. So this amount of food that we think was making an impact, that's probably not making the same impact anymore. And so right now we're really looking at the amount of food that we're distributing, how often, and really trying to beef up on those nutritious items.
For our obstetrical population, we have patients that we've outlined who would qualify for the FoodRx programs. If I diagnose a patient with gestational diabetes, the first step in her management is changing her diet. So some patients don't have to start on medication if they're able to control their blood sugars adequately with the diet change. And the FoodRx program provides free, nutritious foods that can actually benefit their health.
We are really very intentionally trying to understand how to help people. And collectively, we're using our resources to create some impact and really address the things that are occurring in their lives and help them create some change that will last, hopefully, for generations.